So for those of you who don't know, I'm Kristal Garcia. My topic was on obesity, and my proposition was that obesity fails to meet the criteria to be considered a disease. My reasons for obesity not meeting the standards are, one, it's based more on the BMI, the body mass index, not so much genetics. And obesity itself causes other diseases. And another one is it falls more under the category of substance abuse, in my opinion. So, definition of a disease is a disorder of structure or function that produces symptoms or signs that affect a specific location, and it's not a result of some physical injury. And according to the News Medical Network, obesity is caused by inadequate prenatal, infant and young child nutrition, followed by exposure to high-fat, energy-dense, micronutrient-poor foods, and lack of physical activity. So as mentioned before, obesity is based on the body mass index. The Breakthrough Institute did an article saying that having the BMI of 30 to 35 kilograms per meter squared is not associated with the high death rate. Those overweight, in fact, with a BMI of 25 to 30 kilograms per meter have the lowest death rates. They also, I quoted one of the authors, Jeffrey Cabot, and he said that the decision needs to be made based on the complete profile of the individual and not on some arbitrary cut point in a proxy variable. Unlike diseases which can be diagnosed immediately, physicians would need to view their patient's full history background before diagnosing them as being obese. My second claim is that obesity is a cause itself for other diseases. As stated in the new medical website, obesity causes heart disease, cancer, hypertension, liver and gallbladder disease, and other health risks. If anything, I found that obesity can have some benefits. It does sound weird, but it can. Researcher Alison Aubrey says, if you fall and you fall on vulnerable bone, like the hip, having a little extra fat there might protect you from your hip fracture. It's also useful when one becomes ill and is unable to eat. That extra body fat comes in handy. My last claim is that obesity falls more under the category of substance abuse. When we think of substance abuse, we usually think of alcoholics and smokers, which is the correct form of thinking this way. They're mental and physical changes that we choose to make. And backing on the last point, they're choices that cause diseases. It can be prevented by having a healthy diet and maintaining a stable weight. Some find this difficult because as children, we grow up learning from our superiors and surroundings. When we grow up around people who eat a lot and watch TV, that's all we know. Just like smokers who have parents that sometimes, unfortunately, aren't there for them. Because it starts so young, people like to assume that it can be considered genetic. So, as a conclusion, obesity isn't considered a disease because it's primarily based on your BMI, and it causes other diseases, and it's more of a substance abuse. In reference to a senior fellow at the Cato Institute and author Michael D. Tanner, he says, medicalizing obesity could intensify patient and provider reliance on pharmacological and surgical treatments to achieve a specific body weight, detract from creative social solutions to foster healthy behavior. Thank you.
Lemon peppers, oranges. Dad, it's so beautiful.
All right, let me start at the end of the speech. The quote that you had at the end, I think, would be helpful at the beginning of the speech, suggesting why it is we're talking about this, and that therefore there is a controversy about how it gets classified. Because if it's classified as a disease, then there are all these consequences about how people react to it. Then I think it would make a little bit more sense. So. You did get it into the speech, but I think it would make more sense if that was at the beginning of the speech. You do have a clear statement of your proposition. The contents of the speech are previewed, but when you present the things that are labeled as claims at the beginning, they don't always sound like claims. They often just sound like signposts. And in the body of the speech, I found the same kind of problem, that you're giving explanations here instead of telling us what the inferences are. Another place, though, where it helps a little bit is at the end of the speech in the summary. I think that you do a little bit better job of explaining why you're making inferences off of those points. So the language matters when you're presenting these things, and I think you need to be a little bit more consistent about the way you phrase the arguments from the beginning. For instance, the BMI issue, I wasn't quite sure what it was that you were saying at the beginning. At the end, when you basically says, look, obesity is just defined by BMI, and that is not the equivalent of how diseases get defined. Okay, now I understand what it is you're saying. But it seemed like you spent all this time talking about BMI at the beginning without explaining how it's relevant to the definition of obesity. The second part, and especially the third point, for instance, I do think that you've got an interesting criteria here, maybe arguing that it's related to substance abuse and making a comparison there. But the question then becomes, does that mean that all of the things that have been associated with alcoholism and drug dependence are also not diseases? If that's what it means, that's okay. Just make sure that you state that. And for example, if there are others who have suggested that they shouldn't be designated as diseases, I think that would strengthen your argument, because if that's a parallel analogy that you're making there, and it's a valid analogy, and we've already got the same kind of criticism of these other kinds of problems, then that supports your position. I thought you did a pretty good job citing a lot of factual data and some providing sources for the information, and you had a couple of examples here and there. I do think that, like I said, the discussion of whether or not it constitutes a disease, you have a definition of disease at the beginning, but I'm not even sure that the definition of disease that you give us automatically excludes obesity, and I think you need to give us an explanation on each of the points as you're going through it. See, this goes back to the original definition that I said, which requires that a disease has to do these characteristics, and I just proved that it doesn't do characteristic number one. Now let's go to the second point, which was, disease has to have these particular characteristics, and here's the point that I'm making here. I think you've got the right idea, but it hasn't quite been put together in as coherent a way as it needs to be. All right, thank you.